Hi, my name is Brooke and I'll be the pharmacist today. I'll go ahead and present my patient. Patient's chief complaint is increased asthma symptoms. MT is a 27-year-old African American female. Patient presents with mild persistent asthma and generalized motor seizures that are controlled. Complains of increased asthma symptoms but does not appear to be in acute distress. She has daytime symptoms approximately 3 times a week. She uses her rescue inhaler 3 to 4 times per week, but not usually multiple times a day, and is awakened by her symptoms approximately 1 time per week. Symptoms are not tied to exertion alone. She states that she has good compliance to asthma medications and demonstrates proper inhaler technique. Patient wonders if she is needing a change in her asthma medications. Her past medical history includes mild persistent asthma, approximately one year on her maintenance inhaler at this time. And she also has generalized motor seizure disorder, approximately 2 months, and she has been stable with topiramate. Her family history is not significantly pertinent here, but her mother did die of an myocardial infarction at age 62. Her social history includes she denies recent alcohol use, she was a former smoker, and she states that she quit 3 years ago. She lives in a rented home with her husband. She's a full-time graduate law student, and her insurance is Blue Cross Blue Shield through her employer. Her medication allergies include gabapentin with a reaction of edema, topiramate 100 milligrams twice daily by mouth, Trispentec 1 tablet by mouth daily, Flovent HFA inhaler 44 micrograms twice daily, puffs, and then she does albuterol 90 micrograms, 2 puffs every 4 hours PRN, and that is the Ventolin branding. And then her immunization is up to date, influenza January of 2020. A review of symptoms and physical findings. Her reviews of symptoms include positive for lethargy, no acute distress, positive for intermittent insomnia. She has increased in asthma symptoms per her HBI, but she has no acute distress presently. Her physical exam includes that she's a well-nourished female, appears normal age. She's positive for mild wheezing. She has no murmurs, rubs, gallops, normal bowel sounds, no tenderness or guarding, no palpitation, normal capillary refill. And then her vitals include her blood pressure is 110/72, her heart rate is 90 beats per minute, her temperature is 36.8 degrees Celsius, and she is afebrile. Her respiratory rate is 18, her height is 69 inches, her weight is 158 pounds. 71.82 kilograms. Her BMI is 23.3. Her laboratory and diagnostic tests revealed her labs were all within normal range. She has a serum creatinine of 0.8 and her creatinine clearance is 120. Now on to our assessment and plan. The patient's problem is patient has experienced increased asthma symptoms. She has uncontrolled mild persistent asthma and she does not have acute exacerbation. The evidence relating to this problem is the patient states that she had increased daytime symptoms. Symptoms are 3 times a week. Rescue inhaler she uses 3 to 4 times per week, but does not necessarily use it more than once per day. She is awakened by symptoms 1 night per week. Symptoms are not always tied to exertion, and she has compliance with her current medications. Per GINA guidelines, the patient has uncontrolled asthma symptoms, even though she does have a current regimen. So per GINA guidelines, we will be stepping up her therapy based on the symptoms that she's having with the current therapy that she has right now. And our goals for her problem are to control the patient's asthma symptoms and decrease the use of the rescue inhaler. So per the GINA guidelines, for her uncontrolled asthma symptoms, we would step up to a level 3 therapy and initiate a low-dose ICS LABA. And so my drug recommendation for this patient is Symbicort 80 micrograms of budesonide per 4.5 micrograms of formoterol, and the route of administration will be inhalation, 2 puffs twice daily, and the duration for this inhaler will be indefinite, and we will definitely want to reassess our patient in 1 to 3 months. And onto the monitoring section for this patient, the safety and toxicity warnings, we just want to watch for headaches, and then thrush is a big one, so we want to make sure that the patient isn't experiencing that with the ICS part of the regimen that we're recommending. And then the side effect of a LABA can be a tachycardia, and so we just want to make sure that we're watching out for that as well. And then efficacy for the Symbicort recommendation for this patient. would be we want to make sure that the symptoms are controlled, that the patient is having a decrease in exacerbation, and that there's lessening use of the albuterol inhaler for the rescue. And we just want to make sure that we follow up with this patient in approximately 1 month and just make sure that the patient's regimen is working. Thank you. If you have any questions, please let me know.